So what's your job?
I'm an ultrasound technician. My actual title is an RDMS, that stands for a Registered Diagnostic Medical Sonographer.
Okay. And are you coming to us from the position of giving us medical advice as a medical doctor? From what position are you coming?
No, I'm not a medical doctor, so this is not medical advice. I am just basing my testimony here today just based on my experience. I've done ultrasound for 16 years. I've worked in a large hospital. I've also done contract work and worked at a smaller doctor's office as well. So I've had a wide variety of patients I've dealt with, including many, many pregnant women, and I have seen ectopic pregnancies. So my explanation today is based on my knowledge, what I have read and studied in case studies, and also my 16 years experience.
Sarah, we've heard a lot about ectopic pregnancies. Are ectopic pregnancies a reason not to get behind SB13, the Abolish Abortion Act in Oklahoma?
It's a really good question, and the answer is no. That's definitely not a reason not to support a righteous bill like SB13, and here's why. Ectopic pregnancies are definitely a serious medical condition, and it does happen, although rare, and it does happen. It can happen in the tube. And first of all, what an ectopic pregnancy is an abnormal pregnancy that's developed somewhere outside the uterus. Most commonly, it's in the tube or a fallopian tube, but it can happen other places as well. And it's outside the tube, and medical technology is such that we can determine that based on an ultrasound. Oftentimes, though, they're actually misdiagnosed because they can actually look like what's called a corpus luteal cyst or a complex cyst, and it can be easily misdiagnosed. So if the mother comes in and she's unstable, we can admit her to the hospital, do what's called watchful waiting, make sure we confirm that the ectopic pregnancy is in fact an ectopic pregnancy. Sometimes when we actually wait, we find out that it's just really early IUP or intrauterine pregnancy, and that mass that we saw in the nexa by the ovary was in fact not an ectopic at all, but a cyst that just normally, it just resolves on its own. So first of all, we want to make sure that we preserve both the life of the mother and the baby, of course, that we have two patients. So if we do watchful waiting, we can make sure that the diagnosis is correct. The second part is, the vast majority of ectopics, if it is a true ectopic in the tube, when I have seen ectopics, it has already been dead upon arrival. What I mean by that is, by the time a mom starts having symptoms, spotting, pain, some symptoms as she comes into the emergency room, one of the very first tests that we do is an ultrasound to evaluate that. And I don't see this big baby moving and kicking in a heartbeat that somebody might think of a normal intrauterine pregnancy. It's developing in a place where it's not supposed to. So it's not developing normally. So oftentimes we don't even see a gestational sac. We just see a collection of cells, whether it's early embryonic cells or chorionic villi that's going to start the placenta, and it's starting to grow there. And there's the proliferation of other cells besides the cells that are making the baby. So the baby has actually stopped growing, but this mass is continuing to grow. And we can then intervene at that time, and we know that the baby has passed away. But we still do have to intervene because that tube can still rupture because there's still abnormal growth. Mm-hmm. So the vast majority of the time in my experience is the ectopic actually isn't even living. A lot of the times it's already passed away. There is no living baby. And of course that's not an abortion. We're removing something that's already dead. We're not taking a life. And, but we still do intervene at that point.
So when you intervene, let's say that the ectopic, let's say it was in the fallopian tube, okay, and there was a living baby. Yes. There's a couple questions then that come in that are kind of scary and need to be addressed. Is a doctor who has to remove a baby from a fallopian tube or elsewhere, it's ectopic, is he considered a murderer?
In my opinion, no. I wouldn't see how he would be. He's taken an oath to preserve both the life of his patients. And in this case, he has two patients. He has two human beings he's supposed to take care of. Now, if he goes along and he tries to preserve the life of the mother, he's not directly trying to harm an intent. The intent is not to harm the baby. There have been some reports that it is possible, potentially, to remove an ectopic pregnancy and transplant them. I don't know that is possible, but with the abolition of abortion, we're going to be forced to advance medical technology and look for solutions to problems than what we otherwise would not have looked into. It's just an easy answer to say, well, this is potentially a problem, let's just kill it now. and then you can try again for another baby later, instead of saying, no, we really do have 2 patients here, and we have to look for a solution to take care of that baby. So if we do, in fact, see an ectopic pregnancy, which again is rare, and then if we see an actual living baby, which is about 6 or 7 weeks, it rarely makes it even beyond that point, a baby with a beating heart, that's even more rare of the rare, we do have to find solutions to that. But I would not think in SB13 that it's going to criminalize a doctor for trying to intervene as best he knows how and exhaust all efforts available to save both lives.
Yeah, there's already laws on the books in Oklahoma that don't criminalize a doctor in the event that he has to make a medical triage decision. Right.
Correct. Yes.
So there's just a difference of intent and goals under the Hippocratic Oath than there is in the intention and goals with abortion.
Right. And I like to add too that abortion facilities are not set up to treat ectopic pregnancies. It's a real medical condition that has to be treated within a hospital. Nobody goes to an abortion facility for ectopic treatment. They're not set up, it's not a real surgical center. They're set up to kill babies in their uterus, to empty the uterus. They go through a different means to kill that baby. They're not setting up as an actual surgery. And if they would, in fact, find an ectopic pregnancy, well, first of all, I don't think the people are really qualified to make those medical diagnoses, because they really aren't RDMSs or aren't real nurses. They can be Joe Schmo off the street and be doing an ultrasound in these places. But if they do, in fact, think that they find one, they would hands off, and the right thing to do would be to send them to the emergency room. Instead of sending them home. But they're not going to treat them. They can't disperse the pills to treat them, and they're not going to do the surgery to treat them. So shutting down these abortion facilities are still going to allow treatment for ectopics, because they do have to go to a hospital. And
people schedule abortions.
correct, yeah. And so this would be a potentially life-threatening situation, or a very, very serious at the very least. And so you're not going to schedule an appointment and say, hey, if they can have an ectopic, or I have immediate pain, can I come in? They're going to say, can you come in Tuesday at 2 to schedule an appointment? They don't, it's just not going to happen.
Yeah, so that gets to another question of intent.
Sure.
A mother. Is a mother who wants to be a mom and who has an ectopic pregnancy, she doesn't have the intent to kill her child, right?
Yeah, that's a very good point, actually. Yeah, she doesn't have the intent. She's wanting to be pregnant or wanting to have a baby. Nobody wants to have an ectopic pregnancy.
The doctor typically considers these pregnancies fatal, so abortion is the prescribed solution. Now, the concern would be that SB13 would make doctors who perform procedures during ectopic pregnancies murderers, and would make the mother liable for murder. Is this what SB13 does?
So that's true, that's the rumor, and that's come up with some videos recently saying that that's what it does. And people who say that that's what Senate Bill 13 does, they either didn't read the bill or they're flat out lying, period. That's all there is to it. So there's a short answer and a long answer, and I'll try to hit both of them as quick as I can. Essentially, when it comes to ectopic pregnancies or any type of birth anomalies or pregnancy anomalies, what we did with Senate Bill 13 to kind of squelch the whole health issue is we took existing law or existing language from other areas of the health law, and it essentially says, and I'll paraphrase, but you'll get it, it basically says a doctor's charged to exhaust all medical possibilities and resources to save both lives. That's all it says. Just like if he has 2 people on the operating table, he has to do everything he can in his medical power and with his medical training to save both lives. That's all he can do. And so that language immediately just silences anybody who has an issue with the ectopic pregnancy.